Now, league tables for GP surgeries are to be introduced in an attempt to increase the number of face-to-face appointments.
Practices that fail to provide an appropriate level of appointments in person won't be eligible for £250 million worth of new NHS funding. Let's speak to the Health and Social Care Secretary, Sajid Javid, now. Very good morning to you, Mr Javid. Could you just first explain for us how the system will work?
Yeah, let me tell you at the start that I want to thank GPs for the phenomenal work that they've been doing, especially during the pandemic, but of course everything they continue to do. And I want to support them in doing what they do best, which is to see patients, to see more patients properly in a way that the patients choose. And that's what today's announcement is about. This package is support at multiple levels, based on the feedback that we got from GPs. So, for example, they wanted more funding to increase capacity, and we're providing that over the winter, an additional £250 million. I was told that some of the infection protection controls, in their view, wasn't needed. We needed an independent review of that, and that's what the UK Health Security Agency has done, and they'll be changing some of those rules. And then also, I was told that there's just too much on, and can others help in the primary care system, and that's why we'll be expanding the community pharmacy scheme. And all of this taken together means GPs can see more patients, can see them properly, and offer more and more face-to-face appointments.
So, talk me through this. Guide me through. If I'm a GP listening to what you're saying this morning, I have a GP practice. So I think, to be honest, I'm doing a pretty good job. I'm seeing the people who need to be seen. I'm trying to work under enormous pressure, as I have been throughout the pandemic. What have I got to do to access this £250 million, my share of that? What do I have to prove?
Well, GPs, as you know, your listeners will know, they will have their contracts with the NHS. This funding will be provided through their relationship with the NHS. And I think all they will have to do is to show that how they will use the extra funding to increase capacity, to see more patients, and to give patients choice in how that they've seen. And that is something that can be done very quickly. This money will hit the ground really quickly. It's over the next 5 months. By the way, this is on top of all the extra funding we've put into primary care over the last few years, an additional, I think, £4.5 billion a year under the NHS's long-term plan. But this extra funding will help increase capacity. But also, these measures go beyond just funding. There were other things that the GPs had talked about cutting red tape, about getting help from other parts of the primary care system, pharmacists, for example. And so by doing all of those and doing it at once, it can really help to surge capacity.
So if I'm running a GP practice and I think I'm doing it correctly at the moment, I run my GP practice and I think I know best. They don't think you as a government know better than they do how to run their practice. And I write to my local NHS and I say, I think what we're doing is exactly right. Can I have access to the funding? Is it a no, because your assumption is that they have to change?
Well, the funding there is to increase capacity. And I think most people appreciate that different practices are in different positions in being able to do that. And the funding will be targeted at those that need it to increase capacity. And you're right, there may well be practices, and I'm sure there are, that actually are being able right now, as we speak, able to offer the patients the choice that they want. They're able to see them promptly in the cases where it's necessary to see them on the same day.
If I may, Mr Javid, the point I'd like to make to you is that, are you suggesting there are some GP practices that don't need any more money right now? Because all GP practices have been working under the most intense pressure. We know that there is a backlog of people trying to see GPs. So why don't you just give GP practices more money? Why put them under the cosh to prove something in advance?
Well, I'd say a couple of things to that, Charlie, if I may. Is that, first of all, especially during the pandemic, that's exactly what we've done. During the pandemic, we've put in an extra, I think, £45 billion last year, £34 billion this year into the NHS and care, and much of that is gone into primary care, including, of course, GP practices. So that's one thing that's already happened. What this announcement is about is specifically about increasing capacity so that more patients can be seen in the way that they want to and be seen.
Well, so give
promptly.
them all some more money. It seems fairly straightforward. And in relation to how GPs themselves have reacted to this, you may be familiar, one of our regular GPs on this programme is Dr. Rosemary Leonard, who's a very well-respected voice amongst GPs. And she says what you, Sajid Javid, as Health Secretary, are doing is stirring up anti-GP rhetoric. On top of which, she says that if you're saying that they should go out and hire more staff to get more people to work for them, and I think one of the plans is to get locums, temporary staff in, she says you have no idea because there are no locums to employ. That's the problem.
Well, if I say, again, a couple of things with that. I mean, first of all, the GPs, as I say, they have done an absolutely phenomenal job. We are so lucky to have our system of primary care and the fantastic GPs that we have. What they have also been under, especially over the last 2 years, is an enormous amount of pressure, and they've risen to that pressure. For example, the work that they've done on the vaccination program and continue to do on vaccinations. This is about providing more support, and I think I've set out how it provides more support. But let me also say one more thing, if I may, is that there are people out there, and I've seen it myself on social media, that have, just one example, that have given abuse to GPs. There's actually been violence against GPs, and it is completely, totally unacceptable. There will be a zero tolerance policy, and one of the things I wanted to do in this package, again based on the feedback I was getting from GPs, is offer support on that, and that's why it also includes a £5 million security fund. So if there are practices that think they might need, for example, CCTV, panic buttons or other kind of support, then that is available if that's what they think they need.
I feel like you're slightly missing the point that the one GP we spoke to, I accept it's only one GP, but it seems to represent something more generally. I'm looking at the BMA response to what you said. They've said the package as a whole offers very little, shows a government completely out of touch with the scale of the crisis on the ground. And this seems to be the key issue. You're talking about installing CCTV if people are angry. You're being accused this morning by a GP of stirring up the rhetoric, the anti-GP rhetoric. They are accusing you of that.
Well, this is a support package. I mean, I think most people find it hard to see how £250 million of extra funding, how changes in red tape that's asked for, about how getting pharmacists to help take some of the workload, how that is actually not going to help GPs in terms of what they actually love doing best, which is seeing their patients. This is all about support, especially over this crucial winter period. And let's remember, during this pandemic, we've had people rightly and understandably stay away from the NHS, including their doctors, because they were asked to during the height of the pandemic. There are many people out there on waiting lists that need help, they need support, and it's important that they now come forward and they get that support, including to their doctors. And it makes sense to ask people to do that, but at the same time to provide the support that GPs have asked for. That's what this is about.
Why are
and
you
we continue to work with GPs in partnership to see what more we can do.
Why are you not emboldening GPs to make their own decisions? I mean, again, GP this morning says she got an angry email from a patient demanding to be seen face-to-face because they had a blocked nose for a week. Now, I'm sort of thinking your mantra seems to be, well, it's quite right, the patient's right, they should see the GP. What are they supposed to do in those circumstances, for fear now that if they don't say yes, you and your government cohorts will come along and say, do you know what, why aren't you seeing people face-to-face?
Look, patient preference is hugely important, and GPs that I speak to, they absolutely understand that, and what they've said is that we need more support to do that.
Hold on a minute, hold on a minute. I'm asking you something quite specific here. You're not a doctor, and neither am I. But you're saying the patient is always right, effectively, if I'm understanding you rightly. So if patients demanding to be seen face-to-face, which the GP determines to be not important, so they could do this over the phone, you seem to be saying that the patient's right. They should always be seen face-to-face.
Of course, a GP will have a relationship with their patient, and they will, the patient in the first instance will call through to the surgery. There will be a discussion, and GPs will make a decision with that patient, and they will decide what's clinically appropriate. But in cases where it's clear that the patient should be seen face-to-face, if that's what they want, and it's important that the patient is given a choice, this is the package that's going to help to do that. We need to provide more support. I felt that was what was necessary when, soon after I came into this job and started talking to GPs and other people involved in primary care. And this is a very comprehensive comprehensive package that we've put together with the NHS with fresh funding and support in so many ways. And I think it's going to make a difference when you take it all together, and it's going to help.
Okay, are there fewer GPs now than there were 2 years ago?
No, there's 1,200 more on a full-time equivalent basis.
My understanding was that there are 2,000 fewer GPs now than there were 5 years ago. And the fear is that part of the pressure being put on GPs now, for a number of reasons, is that a lot more will retire early, and that will compound the problem.
But we do have too few GPs, and the government has been clear about that now for a number of years. You asked me over the last 2 years, and in fact the numbers have gone up over the last 2 years, not by enough, but they have gone up. But we also need to keep investing in that, and that's why, for example, this year I was really pleased to see that the number of students entering medical school to become our future GPs was the highest number ever. So we've got to keep investing in recruitment, and of course at the other end, GPs will retire when they choose to retire, but we've got to keep investing and make sure more people are attracted into primary care, and that is a priority. It remains a priority, and we're putting a record amount of investment into that too.
And just to be absolutely clear, so you're saying that there are more GPs arriving into the profession than there are leaving, because it's a very important difference, isn't it?
Well, you asked me to be precise. What I'm being precise about is that I think you asked me over the last 2 years, is that over the last 2 years there's an increase, I think around 1,200 in terms of full-time GPs. And as I've said, that's not enough. We need to keep investing, and that's why seeing more student numbers is encouraging as well. Of course, we also get GPs from abroad and things, so it's not just new students from medical school, and it's important that we keep investing in that.
Sajid Javid, I think it's important, you're obviously new in the job. We haven't spoken to you since the coronavirus lessons learned report. Are you prepared to say, in your role as Health Secretary, it's a very important voice you have, especially for the families of those who lost loved ones, are you prepared to say sorry, an unequivocal sorry, for the failures that took place?
Oh, yes, of course I'm sorry for... I mean, obviously, as you say, I'm new in the role, but on behalf of the government, I'm sorry for, during the pandemic, for anyone that suffered, and especially anyone that lost a loved one, a mother, a dad, a brother, a sister, a friend. Of course I'm sorry for that. And also all those people that they may not have lost someone, but they're still suffering. There are many people sadly suffering from long COVID, and we still don't know the long-term impact of that. Of course I am, and there will be lessons to learn from this pandemic. For this government, for governments across the world, there will be lessons, and it's important that is done. There's going to be a public inquiry, and I think that's the best place to learn these lessons, and I don't want to preempt any outcome from that. But if you're asking me, am I sorry? I mean, of course I am.
Sajid Javid, we appreciate your time this morning. Thank you very much.